Hello, this is Dale Maxwell for Paul. Reviewing your answers to my questions. So, good thing you changed your diet and lost weight. That's not a problem. You will need to adjust your diet as you move through this, taking in more of the dense, high protein items like beans and sweet potatoes, rice. Um, you have to move that in so that you don't go beyond your comfort zone of where you would like to be weighing. Okay. Um, yeah, cannabis oil isn't really a cancer killer. So, pancreatic enzymes will definitely help you um, dissolve the cancer material. Um, you're probably going to have some pain for a while since you had spinal surgery and repair to your uh, vertebrae. Um, Thyroid, you'll need to play with the amount. I don't know if you're taking Synthroid, which is synthetic, or actual armor thyroid, but you'll need to adjust the dosage. If you can get the medical people to let you take the armor, it's going to be closer to what your body makes or used to make. There's still some part, if they only removed part of it, there's still some that will be producing. So you need to adjust so that you have energy. The diet should help with energy. Um, yeah, we need to keep you well hydrated. So water enemas before the coffee enemas. Plenty of water every day. Distilled water is your best bet. Avoid the alkaline water because it has minerals in it to make it be alkaline, and they're not the size your body needs. You need to take green plant material to get good amounts of calcium and minerals. Okay. Okay. Make sure you get the emotional releasing documents so that you can start releasing the energy about this. Um, okay. Since you've been in the hospital recently, you probably want to replenish your good bacteria in your gut. I'm going to recommend the um, clinical strength probiotics, 2 containers. Take one package per day for 30 days, and and then you can continue on with the other probiotics that are available that aren't so strong. But you need to rebuild because whenever you go through any kind of a medical procedure, they just tend to kill all the good bacteria, or at least a big portion of it. Okay. Um, I don't know if you're still taking water pills for lowering blood pressure, but as your weight goes down and your diet changes, you should be watching if you are taking any uh, to make sure that you're not getting too low a blood pressure, and then get off it as soon as you can. No root canals is good. One amalgam, well, once you get at least 2 months into the enzymes and you're stronger and you're starting to heal, it would be okay to remove the amalgam with a dental practitioner who knows how to remove amalgam safely using dams and safe evacuation of the mercury that will be removed. And then good to chelate the um, mercury that's been poisoning you. Okay. The Select Budwig is okay if you're uh, good with it and it's treating you right. You want to make sure by testing your blood to make sure you're not getting over amounts of calcium. The calcium in the Select is not the best calcium. Um, and I always recommend people to test to see if the Select is good. So what you do is you keep track for at least a week. I know you probably haven't been doing that, but most people don't. And see how much energy you have. And then when you come off of it for a week, substituting all green juices and stuff, you may get an equal amount of energy. If you do, then getting rid of the um, Select Budwig protocol is fine, especially the cottage cheese part. If you are going to continue Select, I don't recommend you take more than one serving of Select a day because of the calcium in it being animal, uh, not the best choice. Okay. If you're taking carrot, vegetable carrot uh, drinks every day, 8, those are fine. But you need to make sure you're eating something with them. You need to be eating baked potato, sweet potato, salad, something with them because taking them by themselves will spike your blood sugar and make your pancreas work hard. Okay, so um, if you study the Gerson therapy, go to their clinic in Mexico, you find out you eat all the time. Okay, um, so the Rife machine for 2 hours. There's a lot of different frequencies. I don't know which ones you're using. I'm going to also recommend you consider a pulse magnetic therapy, particularly for you to be applied to the area where you were having surgery to help make your cells more active and work better. Okay, it's a closer therapy to what your body uses than the right machine therapy. Um, the apricot seeds, grind them up. All seeds should be soaked and ground. Uh, and I would also recommend you don't use flax oil once you get off of the cottage cheese. Use flax seeds ground up instead. Okay, get the benefit without the potential of having the flax oil being turned. Um, and oh, here's this question. This has to do with what you need to eat. All of the beans, rice, brown rice, and sweet potatoes that you can put in. Any green things, what I do is I take the 1.5 pound bags of super greens from Costco. I put them in the freezer, and once they're frozen solid, I vent the container and then crush them with my feet, with my shoes, to in the bag to turn them into a powder. Then you can add them to the drinks, so you can add them in with the blender. Um, so and definitely you will not be hungry if you're eating. I recommend a 3-2-1 ratio. Potatoes 3 ounces, sweet potatoes, 2 ounces of beans. I like black beans, but any beans will do, whatever you like, and 1 ounce of brown rice, and that gives you a nice balance. You can eat it as often as you want. You won't be hungry, and it's good protein. Okay. Um, yeah, the Biomedici that I'll give you a link to is also going to be helping with the numbness in your hands. That's probably because you're not healing perfectly on your vertebrae. And watch out because they're going to want to do another surgery to try and correct it, and that doesn't work. Okay, so this is Dale Maxwell, and thank you very much for allowing me to point you in the right direction for getting your body to heal itself. Remember, the enzymes are not a replacement for good exercise, good mental activity, uh, and plenty of um, good organic food. Okay, thank you very much. Bye bye.